Breastfeeding in the childcare setting, creating a supportive environment. This presentation was compiled in collaboration with the Maine Roads to Quality program and the State of Maine Breastfeeding Stakeholders Committee. So why is it necessary to support breastfeeding in the childcare setting? Take some time to think about this question. Think about your current and past views on the subject of breastfeeding. Take a few minutes to jot down your views on the answers to this question. According to the third edition of Caring for Our Children, early care and education programs can reduce the breastfeeding mother's anxiety by welcoming breastfeeding families and providing a staff that is well trained on the handling and feeding of breast milk. This is true not only for the parents who access your facilities for childcare, but also for your breastfeeding staff. There are a number of women in the workforce today. According to a study by Payne and Nichols, breastfeeding women often find themselves struggling between the role of what we deem the good worker and the role of the good mother. Being a good mother to the women in this study meant being able to provide the best health benefit to their child, i.e., breast milk. This role often came into conflict with the role of the good worker, which would put strains on being able to maintain their breastfeeding goals. Examples are having to take additional break time for pumping, making the time to pump, no matter how hectic the work schedule, and perhaps feeling unsupported in the workplace for those efforts. The benefits of breast milk to a child are great. There is a decreased risk of childhood and adolescent obesity and an increased protection against asthma and eczema when breastfed exclusively for at least 4 months. Exclusive breastfeeding of a child with a family history of diabetes for at least 4 months reduces their risk of insulin dependent, also called juvenile onset diabetes. According to the United States Breastfeeding Committee, children who are breastfed score higher on cognitive and IQ tests and have a decrease in infant mortality rates by 21%. The incidence of infectious disease is also greatly decreased in children who are breastfed. These diseases include diarrhea, respiratory tract infections, ear infections, meningitis, necrotizing enterocolitis, urinary tract infections, and late-onset sepsis in preterm infants. Beyond the benefits of breastfeeding for the child, which we just discussed, there are also benefits to be had of the breastfeeding mother. The benefits for the mom include cost, when you compare breastfeeding to other feeding options, decreased postpartum bleeding, early return to pre-pregnancy weight, decreased risk of cancer, which includes breast and ovarian cancers, and there is also a possible decreased risk of osteoporosis when a woman who is breastfed enters the postmenopausal period of life. As an employer, there are benefits to supporting breastfeeding mothers in the workplace. There's decreased turnover. There's productivity improvement because there's lower absenteeism. There's increased morale and loyalty to the employer. There's an average annual savings of equal to $400 per breastfed baby because of lower medical costs and fewer health insurance claims. And lastly, it's the law. So as employers, we really need to support our breastfeeding mothers. Ways to create breastfeeding-friendly workplaces include providing the breastfeeding mom with a flexible work schedule so that she can pump without feeling pulled between those two roles we mentioned earlier of being the good mother versus being the good worker. Support a mother when she comes back from maternity leave in her decision to breastfeed. It will help in her transition process back to work, and it will help with her morale and her breastfeeding efforts. Also, as a workplace to create a breastfeeding-friendly environment, make sure you're able to provide an accessible location for pumping, one that's private, that's not a bathroom facility, where the mom can really relax for those 15-20 minutes at a time to pump throughout the day. Maine's labor law was amended in September 2009 to state the following. For an employee who is a nursing mother, the employer shall, for 3 years after the birth of a child, provide adequate unpaid break time, or permit an employee to use paid break time or meal time each day to express breast milk for her nursing child. The employer shall also make reasonable efforts to provide a clean room or other location other than a bathroom where an employee may express breast milk in privacy. An employer may be exempted from this section if providing time or an appropriate private space for expressing breast milk would substantially disrupt the employer's operations. An employer shall not retaliate or discriminate against an employee who exercises the right provided under this section. Additional breastfeeding protection in Maine is the Nursing in Public Law. This states that Maine law provides protection for women who nurse in public. A mother may breastfeed her baby in any location, public or private, where the mother is otherwise authorized to be. So this does include childcare settings. There's a bumper sticker I have hanging above my computer at work, and I've grown very fond of it over the years. It states affordable health care begins with breastfeeding. Take a minute to think about that phrase. Children that are breastfed are on average healthier children than children who are not breastfed. The decrease in medical costs means an increase in monies back into families' pockets. Parents whose children aren't sick have less time they must take off from work, a benefit for you as a child care provider as well. As a whole, families who are healthier have more time to bond with one another, with less focus and stress placed on illness. Recent research shows that if 90% of families breastfed exclusively for 6 months, nearly 1,000 deaths among infants would be prevented. The U.S. would also save $13 billion per year on medical costs. Medical care costs are lower for fully breastfed versus never breastfed infants. So in the childcare setting, here are some ways that we can create a supportive environment for breastfeeding. Develop a workplace policy on the subject. Identify a clean, private place with access to electrical outlets and chairs where either a mother on your staff or a mother of the children in your care who are breastfeeding can go and pump in private. Orient employees and parents to the policy you've created. And then offer flexible breaks to any staff you have that are nursing mothers. This is an example of an ideal setting that depicts an actual space at a childcare facility in Maine that is specifically available for a mother to breastfeed her child in private, if so desired to breastfeed in private, or to also privately express her breast milk. Some things to make note of are the lighting used in the room, the comfortable chair, the positioning pillow, the sink and hand sanitizer, as well as outlets that are available on the walls. In addition to creating a space such as this, culturally appropriate materials that support breastfeeding could also be on display. These would include posters, pictures, and signage. Keep in mind that this example is an example of an ideal setting. Space made available at your own facilities will need to best accommodate the resources that you have available. Beyond creating a culture that supports the breastfeeding mother to comfortably breastfeed and/or express breast milk at your settings, we must also create an environment for our children that fosters breastfeeding. Play materials can help normalize breastfeeding, such as these children's books, with baby dolls nearby to promote modeling behavior. These are additional samples of children's books that can be found in the reference section of this presentation. We're going to spend some time over the next few slides talking about a sample childcare center breastfeeding policy. The resource for this slide is taken from Mississippi Breastfeeding Coalition's Building Breastfeeding Friendly Communities project by the Wisconsin Department of Health and Family Services in collaboration with the Wisconsin Breastfeeding Coalition Division of Public Health Nutrition section. So to start up a policy taken directly from this source, here is an example how you could start it. Because breastfeeding has been shown to be the superior form of infant nutrition, providing a multitude of health benefits to both infant and mother, and because breastfeeding employees need ongoing support from childcare providers to provide their milk for their babies, insert your childcare center name, subscribes to the following policy. And number 1 states breastfeeding mothers shall be provided a place to breastfeed or express their milk. This area, as we discussed before, should provide an electrical outlet, comfortable chair, and nearby access to running water at the very least. Number 2 on the sample breastfeeding policy is about making available a refrigerator to store express breast milk. This refrigerator should be available both to breastfeeding mothers of children within your care and breastfeeding mothers who are employees at your sites. Mothers should be able to provide their own containers with the express breast milk. That should not be up to the site responsibility. These containers should be clearly labeled with the name of the child it's intended for and the date the milk was expressed, so you can make sure you're complying by using the oldest milk first. The center will follow guidelines from the American Academy of Pediatrics and the Centers for Disease Control to ensure that breast milk is properly treated to avoid any waste. Though universal precautions are not required in handling human milk, it is necessary to wash your hands before you're preparing any food source for yourself or for a child within your care. The next section of policy development should discuss sensitivity will be shown to breastfeeding mothers and their babies. The Child Care Center is committed to providing ongoing support to breastfeeding mothers, including providing an opportunity to breastfeed their baby in the morning and evening and holding off on giving a bottle, if possible, when mom is due to arrive, which we discussed previously. Artificial baby milks and solid foods will not be provided to a child unless the mother has requested. So if, for example, the baby's 4 months old and you're feeling, based on your experience, that baby may be ready for solid foods, well, our current, AAP recommendations recommend that a baby not receive solid foods until approximately 6 months of age. And if a mother is exclusively breastfeeding her child, it's not up to you, the child care provider, to make that decision. So it's good for you to have open communication with the mother and with the parents of children within your care to make sure that the parents' wishes are being followed through with. Babies should be held closely when feeding, and bottles shouldn't be propped. So a child shouldn't be sat, in a car seat or in a swing and just handed the bottle. During a feeding time, a baby should be held. Breastfeeding policy development at your site should also include the following. All staff shall be trained in handling human milk. Breastfeeding employees shall be provided a flexible schedule for breastfeeding or pumping to provide breast milk for their children. The time allowed would not exceed the normal time allowed for lunch and breaks. For time above and beyond normal lunch and breaks, you can allow sick or annual leave to be used, or you can come in, you can ask the employee to come in a little earlier or leave a little late to make up the time. And these are just examples. You can decide at your own setting what's going to work best around your policies and procedures to best accommodate these mothers. Number 6, the center will provide information on breastfeeding, including the names of area resources, should questions or problems arise. In addition, positive promotion of breastfeeding will be on display in the center. And number 7, in creating a policy around breastfeeding, you should think about including in your handbook information on your site being a baby-friendly facility. This is an example of a resource available to you online that can help you promote your facility as breastfeeding friendly. The reference is listed right on the slide. There are 10 steps that are outlined in this tool that are geared towards childcare facilities becoming breastfeeding friendly. And these are the 10 steps. Number 1 is to designate an individual or group who is responsible for the development and implementation of the 10 steps. So, identifying who that team of people is going to be. In the smaller sites, it may be, yourself. If it's your own home-based center, it may be yourself. Or if it's you and one other person running a center or a site out of your home, it may be just the two of you. In the larger centers where you have a number of employees, you may be able to identify a small group of people who are willing to work on this particular project. Number 2 in the 10 steps is to establish a supportive breastfeeding policy, and then require all staff be aware of and follow the policy. And make sure you review your policies annually and take a look at what's working in those policies and see if things need to be changed or updated. Number 3 is to establish a supportive worksite policy for staff members who are breastfeeding. So, again, not just a policy for the parents of the children who are in your care, but a policy that also encompasses staff members who may be breastfeeding. Number 4 on the 10 steps in this sample given here is to train all staff so that they are able to carry out the breastfeeding promotion and support activities. Number 5 is to create a culturally appropriate breastfeeding friendly environment. Number 6 is to inform expectant and new families and visitors about your center's breastfeeding friendly policies. So let them know that you're a breastfeeding friendly site. Number 7 is to stimulate participatory learning experiences with the children related to breastfeeding. And some samples were given in earlier slides in regards to creating culturally appropriate environments for children, including books and play toys on the subject. Number 8 is provide a comfortable place for mothers to breastfeed or pump their milk in privacy if they desire to feed in privacy. Again, they're not required to feed in privacy based on the state of Maine law. Number 8 also includes education of families and staff that a mother may breastfeed her child wherever they have a legal right to be. Number 9 is to establish and maintain connections with local breastfeeding coalitions or community breastfeeding resources, and some examples of local resources will be provided here at the end of this presentation. And number 10 is to maintain an updated resource file of community breastfeeding services and resources kept in an accessible area for families to access. Providing signage at your childcare settings is also another way to let families know that you are in support of breastfeeding. This symbol here is actually the International Breastfeeding Symbol. This is a universal signage that is known throughout the world as being in support of breastfeeding. This is actually a free downloadable symbol that you can access from the International Breastfeeding Symbol website, and the reference is located at the end of this presentation. You may print it out and display it at your facilities to show that you support the breastfeeding mother. Additional breastfeeding resources in Maine include the following: the Childcare Health Consultant Network, State of Maine Public Health Nursing, Maine State Breastfeeding Coalition, WIC offices, and local hospital maternity units, as a number of them employ internationally board-certified lactation consultants. To find out where your facility currently stands in regards to infant feeding, I encourage you to take a look at the Let's Move Childcare Infant Feeding Checklist quiz. This is an initiative of First Lady Michelle Obama. The Let's Move Childcare initiative has 5 main goals. 1 is to get kids moving. 2, reduce screen time. 3, make nutrition fun. 4, offer healthier beverages. And 5, support infant feeding. The Let's Move Childcare Infant Feeding Checklist is available online at healthykidshealthyfuture.org. The Let's Move Childcare Infant Feeding Checklist is a self-assessment that covers the following main subject areas: breastfeeding education, breastfeeding environment, and breastfeeding policy. Utilizing this checklist is a good starting point for assessing your individual sites on current practices around breastfeeding and can help identify areas of needed improvement. Now let's take a minute to relook the question we asked at the start of this presentation. Why is it necessary to support breastfeeding in the childcare setting? Have your thoughts changed at all since the beginning of this presentation? Have they stayed the same? According to the Centers for Disease Control, nearly 2/3 of infants are regularly cared for by someone other than a parent. Approximately 50% of these infants attend childcare centers, while the remaining are in home-based settings to include licensed family-based childcare homes or the homes of family and/or friends. Some potential answers to this question can include that breast milk is the best source of nutrients an infant can receive through at least the first 6 months of life. Therefore, efforts need to be supported wherever that child spends their feeding hours, a good portion of which could be at the childcare setting. Prenatal parents and postnatal parents have questions about breastfeeding, and many times are sharing their parenting concerns with their child's caretaker. Having the knowledge of local resources can help support their efforts. As a nation, we have work that needs to be done on increasing our breastfeeding rates, resulting in healthier kids that grow up to be healthier adults. You, as the childcare personnel, are instrumental in creating an environment that supports and encourages breastfeeding. Lastly, with such a large portion of our youth being cared for by additional caregivers, we can see where the childcare provider can play a vital role in promoting breastfeeding among mothers whose children are cared for at these facilities.